the hidden source behind heart attacks and strokes. What no one is telling you. Hi everyone. Have you ever wondered if a serious health issue like a heart attack or stroke could actually start from somewhere completely unexpected in your body? Today, I want to share one of the lesser-known but scientifically supported root causes of heart disease and stroke, something most people never think about. This information comes from well-established medical research, and interestingly, I've had personal experience with it myself. Let's dive into what I call the undeniable evidence. A growing number of studies have discovered something surprising. In a significant percentage of people who suffered a heart attack or had blocked coronary arteries, scientists found bacterial DNA inside their heart tissue, often from bacteria that originally came from root canal-treated teeth. Creepy, right? I briefly mentioned this in a previous video, but the real questions are, why are these disease-causing microbes ending up in your heart? Where do they come from, and how are they related to your dental health? Some studies have even found these same bacteria inside blood clots in stroke patients. Let me share a quick personal story. Not long ago, I went in for a routine dental checkup. My dentist used an advanced tool called a cone beam 3D scan, a type of imaging that scans deep into the jaw and root areas to detect hidden infections. When I saw the scan, there was a large dark area around the root of a tooth I had treated years ago with a root canal. The dentist confirmed it was a subtle abscess slowly eating away at the surrounding bone, and I had absolutely no symptoms, no pain, no swelling. Everything felt totally normal. What really struck me was this. After reading through hundreds of your comments, I realized my story is not unusual. So many people have been living with vague, long-lasting health problems, only to later discover that a silent, hidden dental infection had been quietly affecting their entire body. According to experts who study this topic, chronic low-grade infections may play a key role not just in heart disease, but also in arthritis, immune dysfunction, and other chronic health conditions. One of the most common but overlooked issues is chronic apical periodontitis, or chronic inflammation around the root of a tooth. This condition often produces no pain or noticeable symptoms. But every time you chew bacteria from the infected area, can be pushed deeper into the lymphatic system in your jawbone, eventually spreading throughout your entire body. Each year, millions of people undergo root canal therapy, and one emerging hypothesis in medical research is that root canals may carry hidden risks. During a root canal, the dentist removes infected pulp, cleanses the area, and seals it. The problem is, root canals contain thousands of microscopic dentin tubules, tiny channels, that form a maze-like structure inside the tooth. These microtunnels are nearly impossible to fully disinfect. Even more concerning, once the pulp is removed, the tooth loses its natural immune defense. This could explain why many people develop long-term dental abscesses, chronic jawbone inflammation, and in more serious cases, cardiovascular complications after a root canal. In many instances, these infections don't even show up on traditional dental X-rays. They can only be detected with advanced imaging technology, like cone beam CT scans. I've received numerous messages from viewers who told me they lived with vague symptoms for years: chronic fatigue, widespread inflammation, joint pain, brain fog, or neurological problems, and only began to improve after discovering and treating an undiagnosed dental infection. One way to assess systemic inflammation is through a CRP C-reactive protein test, a well-known blood marker. Inflammation can come from the teeth gum's jawbone or even the tonsils. When your immune system is constantly exposed to bacteria from these hidden infections, it places a heavy burden on the body, especially when your immune defenses are already weakened. These bacteria don't just live in your mouth, which hosts over 500 different microbial species. They also release toxins that trigger strong immune reactions and systemic oxidative stress, an overload of free radicals that your body's antioxidants can't keep up with. One of your body's responses to chronic inflammation is increased clotting activity, which creates the perfect conditions for blood clots to form, leading to a higher risk of heart attack and stroke. So, what can you do if you're feeling drained? Your immune system seems off, or you suspect oxidative stress is affecting you. One helpful support strategy I recommend is taking 12 grams of liposomal vitamin C per day. This form of vitamin C absorbs more efficiently and can enter your cells to fight oxidative stress at a deeper level. Since vitamin C is water-soluble, it's best to split the dosage, such as taking 500 milligrams several times a day to maintain steady blood levels. A major benefit, liposomal vitamin C doesn't cause diarrhea like standard high-dose vitamin C often does. That said, it's important to understand liposomal vitamin C is not a treatment for infection, but rather a supportive tool to help your body stay resilient during inflammation. If you begin to feel better while taking it, that's a valuable sign. It may prompt you to dig deeper to explore root causes that could include your diet, sleep quality, overtraining, or even an undiagnosed dental infection. Now let's talk about your options when you discover an infected tooth, especially one that has already had a root canal but is still causing problems. This is not a simple decision, and it's best made with guidance from a qualified, experienced dentist. Why is it risky to keep an infected tooth? As we discussed earlier, fully cleaning out the root canal system is extremely difficult. Even when a root canal appears successful, bacteria can survive inside microscopic dentin tubules and continue causing low-grade inflammation, silently releasing toxins into your body for years, often without any clear symptoms. When should you consider extracting the tooth? If you have persistent pain in a root canal-treated tooth, if a cone beam CT scan shows recurring infection, or if you're experiencing unexplained systemic symptoms like fatigue, chronic inflammation, or neurological issues, removing the tooth may be the most reasonable option. Many people have reported significant health improvements after having a dead, chronically infected tooth removed. What are your options after tooth extraction? 1. Dental implant. This is the most common choice. If you go this route, be sure to discuss what materials will be used. Zirconia. Ceramic implants are gaining popularity for their biocompatibility, especially for individuals with sensitivities or weakened immune systems. However, implants can be expensive and may not be suitable for everyone. 2. Fixed dental bridge. This option involves shaving down the two neighboring teeth to support the bridge, which may affect otherwise healthy teeth. While it provides good aesthetics, it's not always the preferred method for long-term preservation of oral health. 3. Removable denture partial. This is a more budget-friendly and accessible solution. However, it can be inconvenient when eating or speaking, especially for those who haven't worn a denture before. Each option has its pros and cons, and it's important to talk openly with your dentist to choose the one that fits your overall health budget and lifestyle. So how do you find the right dentist? Look for professionals who practice holistic or biological dentistry. Those who understand the connection between oral health and systemic diseases like heart conditions, neurological issues, or immune dysfunction. Don't hesitate to ask questions about their experience with chronic root infections and about the materials they use for restorations. Choosing the right expert can make a big difference not just for your recovery, but also for your long-term well-being. One of the biggest concerns that many of you have shared in the comments is the high cost of dental care and the fact that dental services are often not covered under general health insurance. This creates a major barrier that prevents many people from accessing the care they truly need. It's a flaw in the system that needs to change. Oral health should be recognized as an essential part of overall health. So what can you do to protect yourself and prevent serious dental-related complications? Practice good oral hygiene. Make sure you brush your teeth at least twice a day. Floss regularly and use a suitable mouthwash to help prevent bacterial buildup. Eat a clean, anti-inflammatory diet. Try to reduce your intake of sugar and processed foods, which can feed harmful bacteria and promote inflammation. Instead, load up on leafy greens, fresh fruits, and nutrient-rich whole foods that support your immune system and oral health from the inside out. Don't wait for problems. See your dentist regularly. Professional checkups and cleanings twice a year can help detect potential issues early before they become painful or expensive to treat. Be thoughtful about major treatment decisions. If your dentist recommends a root canal, take time to research the procedure thoroughly. Consider getting a second opinion if needed. Look for a dentist who has experience, uses modern diagnostic tools, and understands the link between dental health and whole body wellness. Of course, these points are just a small piece of a much larger, more complex picture. I strongly encourage you to keep learning from trusted medical and dental sources to gain a deeper understanding. And if you've gone through something similar, maybe you've dealt with unexplained symptoms, dental infections, root canal issues, or related health problems, please consider sharing your experience in the comments. Your story could be exactly what someone else is looking for. Just remember, this is a space for sharing, not a substitute for professional diagnosis or medical advice. And finally, a gentle reminder. The information in this video is for educational and informational purposes only. It is not a replacement for guidance from your doctor or dentist. If you're dealing with health issues, please speak with a trained healthcare professional. Thank you for watching and for being part of this journey.